Welcome to Hopeful Hints. I'm your host, Dr. Tara Harding. If you're watching on YouTube, welcome. So glad you're here. Thank you for subscribing. Today we're talking about some of my favorite topics, yet the most missed or not talked about enough topics in women's health. And I'm going to help you decode your symptoms. So if your periods are leaving you curled up in bed, you're missing work, school, canceling plans, you are feeling awful during your period, keep listening. If you have irregular cycles, stubborn acne, unexplained weight gain that no doctor has connected the dots on, keep listening. And if you've ever just found yourself wondering, like, is this normal? Do I have PCOS? Do I have endo? Because social media, Google tells me I might, and I do, or your healthcare provider says you maybe, kind of, sort of, might. I don't know. Do you have PCOS, or you did have PCOS? Keep listening. You're in the right place. In this video and on this podcast today, I'm going to break down the hallmark signs of PCOS and endometriosis and how to know when it's, air quote, just hormones versus something more serious, and how you can get some answers. I have had the honor of working with thousands of women and have been on both sides of this conversation. I am an endometriosis patient myself. I'm an infertility patient and a provider, so I know how frustrating this is. My businesses exist because of what I went through when no one would take me serious or say I have unexplained infertility, which I think is a total garbage diagnosis. So stick with me till the end. I'm going to help you identify your symptoms today and give you some actionable steps that you can take today, whether you have a formal diagnosis or not, and what you can do next. Let's begin. PCOS, or polycystic ovarian syndrome. Some classic signs to this are irregular cycles, absent cycles, but I'm going to make it even more confusing. You could have a normal cycle period every month and still have it. It is the lack of ovulation. So unless you are sitting and tracking that ovulation every single month, which I have yet to find a female who's doing that, even if you're going through infertility, it's hard to track that every single month. You can still have PCOS. Oily skin, acne, often on the jawline and the T-zone, but the jawline specifically tends to be more common with PCOS. Excess hair growth to your chin, your face, even if it's a couple. I say you have Shirley, Bill, and Larry. Like, I joke because some women name them. I'm plucking them all the time. Your nipples, your belly. Are you someone who's shaving your legs like every day? That's a red flag. We see that very common in PCOS. Hair thinning, scalp thinning of your hair. Weight gain that is impossible to lose no matter what you're doing, especially around your midsection. Cravings with that as well. The infertility is super common in PCOS because of your inability to ovulate. You're not ovulating. And so once we can resolve that or correct that ovulation piece, we find success with the PCOS patients. Skin tag, dark patches of skin under your arms or your neckline. Now, that is deep or late on, and that is only in certain patients. So what I say to that is there are still healthcare providers out there. If you don't have that, you don't have PCOS. And that's false. That is very outdated medicine. You don't need to have skin tags or darkening of skin. That is not one of the criteria for it. That is one of the many symptoms of PCOS. There's a lot of GI symptoms often correlating with PCOS as well. Anxiety, unexplained anxiety, and mood swings. Super common in PCOS patients as well. And we see just a lot of dismissed symptoms here. If you're listening, this sounds like you. And it's hormones. It is when your androgens or your male hormones are too high and they are suppressing your female hormones like estrogen and progesterone, and you have these symptoms. Very common to have insulin resistance with your PCOS as well. Very common to have chronic low-grade, air quote, that inflammation. It's not going to show up on your lab work. Blood work for cortisol is not great. We don't use that as our check for that. We use urine or even saliva. It's usually the three best friends, I call it. With PCOS, there's hormone involvement, insulin involvement, and cortisol inflammation involvement as well. Let's move to the endo, my diagnoses. I have tons of videos. I have a whole section on PCOS and endo, so head over to that as well if you're on YouTube. It is categorized. I also have free quizzes on my website, drtaraharding.com, for all of these as well that you can take. And these are the topics I talk about the most, is these in teens. Oh my goodness, let's go to that. This is overlooked in teens all the time. And if you're like me, that just, bad periods, here's your birth control. Acne, here's your birth control. If you're looking for some alternative answers to that, here I am. So endometriosis is often just dismissed as bad periods, bad luck, crap luck, you name it, whatever sentence you have heard. So cramps during your period, painful intercourse, heavy bleeding, and clots, that is adenomyosis usually, but endometriosis is usually that pain. When I talk about endometriosis today, I'm going to include symptoms of adenomyosis. That's often a word that doesn't get talked about enough. And I have videos and content on that as well. GI issues, bloating, constipation, period poops, red flag. I blew up on TikTok talking about period poops and how these symptoms of your period are not normal because so many of us are being told this is just how it is. And it's the number one red flag for endometriosis. Pain with urination, pain with bowel movements, specifically around the time of your period. If it feels like you have a UTI, but you go in and you never do. Spotting. So spotting that luteal phase can often be related to endometriosis as well. Spotting with ovulation or after ovulation. Infertility. Again, you will hear me say all day long, unexplained infertility is garbage. The number one cause of that, I do believe, we in the infertility space and the endometriosis space and those who love talking about it believe unexplained infertility is endometriosis until proven otherwise. So really need to, migraines, the chronic pain. So if you are a female and you are constantly going to the chiropractor, your physical therapist, heck, you've even had joint infusions and injections for your chronic pain, and it is not getting better, that is endometriosis until proven otherwise in our eyes. Fibromyalgia, IBS, red flag for endometriosis. So really stepping back and getting into the mindset of might be an answer for these symptoms too. And again, causes hormone imbalances, causes inflammation disruption. If you don't feel like you've met the full criteria or you feel like you've been told you haven't met the criteria for it, it doesn't mean that your symptoms aren't real or that you don't have this. Again, I want you to head over to my quizzes. They are completely free and see if any of them resonate with you too. And even if you get a no on that, meeting with a provider who can take a deeper look at that is really, really important too. Some signs of general hormone imbalance too. Let's keep talking about that. But PMS or PMDD, mood swings. PMDD gets missed all the time. And that is days or week before your cycle starts. You will get a whole slew of symptoms from mood dysregulation, breast tenderness, joint pain, bruising, bloating, cravings, trouble sleeping, everything. You name it. If you are getting symptoms before your period starts, and it is a sign, oh, I know this is happening, this equals period starting, or your loved ones around you can tell, we need to work on hormones with that. Low libido, trouble sleeping, especially post-ovulation. And then big red flags that should never be ignored is missing your periods, especially more than 3 months. If you are missing work or school, or you ever have, like think back in our office, we do a timeline. If you're 39 like me or older, or what have you, whatever your age might be, think back to when you got your period. What was that experience like? And do some of these signs resonate with you? Did you have children and these symptoms started or they changed? Did you get a hysterectomy and you're still having issues? I have a whole video or 2 or 3 on that. Like women are told by OBGYNs, just get a hysterectomy and they'll fix everything. And that is not the case unless you have adenomyosis. But many of you have endometriosis and adenomyosis. So it's very important that your care team can take care of both those things. Pain with sex or bowel movements, failed attempts at fertility treatments or getting pregnant. If you have infertility, we need to hit pause and really dive deep into these 2 topics. Acne, weight gain, even if you're doing all of the healthy things and nothing's working or you even feel worse after that, red flag. We've got to look into that more. So I want you to start tracking your symptoms, your cycles. Get the free apps. I don't love them, but you're allowed to get the free apps and you can track your symptoms in the notes section in there. Better yet, get some apps or home urine testing products where you can check your hormones from home. Even if you're not trying to conceive, these are for you. And then you can make notes in their apps to correlate. What the heck's your progesterone doing? What's your estrogen doing? You can look at these things every morning from your bathroom with these devices. They're great. I will drop some of my favorites in these show notes here, but ask for further hormone panel testing. Ask for a different interpretation of testosterone, DHEA, progesterone. Consider bioidentical progesterone. That is natural, mimicking your body's own. It's not synthetic or big and scary like the other ones too. Additional, if you think you have PCOS, I really want you to advocate for fasting insulin, fasting glucose. Let's look at your A1C. We look at insulin and really focus on that and glucose. And then for endometriosis, ask for a Receptiva. It's one of our favorite uterine biopsies, or we can get some uterine biopsies in office super quick. And then getting a referral to an excision specialist. Whole topic on that. You've heard me preach on that. I have videos on that. If you have questions about that, dip into my inbox. But we really need to advocate for you to be in the hands of a true specialist if you're going to go down the surgery road. Try some small nutritional changes. Protein, protein, protein. Every meal, every snack in the mouth first, or fiber. Eating every 3 to 4 hours. If you're not feeling good or doing well fasting, consider not fasting and explore supplements too. NAC, omega-3s, magnesium, myo-inositol for PCOS, berberine, things like that can really help you with that as well. So if you've been told it's just stress or your labs are normal or you're normal and you're not feeling well, let's start talking about this more. Drop some comments if you're watching today on YouTube with your unanswered symptoms. Head over, do my free quizzes on drtaraharding.com, and let's start figuring out what your body is telling you about what's going on. You deserve answers, you deserve relief, and you deserve a diagnosis, quite frankly. Is it PCOS? Is it endometriosis? Is it adenomyosis? Is there some other hormone imbalance going on? And there is a path forward for you. There is a whole new you on the other side of this. You do not have to figure this out alone. As always, I'm here for you to head over, drop in. I have my group coaching program open where you will get access to me, Dr. Tara Harding, every week, and you will feel better soon. Thank you so much for listening and tuning in. I'll see you back here on the next episode.